So as you can see, this is a sagittal section, this first picture, which shows the position of the larynx. Okay, so we have the tongue, then the projection. This one is the epiglottis. Okay, so behind the epiglottis, it either enters the airway or you enter the esophagus. Right, so epiglottis sits at the junction of the airway and the foot passage. Okay, so what is this depression called behind the tongue? So this is your tongue. What is this depression behind the tongue called? It's called the vallicula. Okay, so it is called the vallicula. So first we have the tongue, then we have the vallicula, and from the end of the vallicula, the larynx starts. So epiglottis is a part of the larynx. Okay, so from the epiglottis till the cricoid cartilage is the larynx. Below the cricoid cartilage, we have the cricotracheal membrane and the start of the trachea. So trachea is not larynx. Larynx sits on the trachea. Okay. So what is the most important function of larynx? I told in a previous clinical class, I was teaching, I think, some other groups, I don't know. So what is the most important function of larynx? Why did God give us larynx? Why did God give us larynx? Something so complex as the larynx. So if you go through the physiology of larynx, it's pretty complex. It's not easy. Okay. But if we just had to phonate, okay, it could have been some other way. There can be so many things. There could have been a bypass, some other organ out there away from the airway. But God gave us larynx. So the primary function of larynx is not phonation. It is protection of the lower airway. And this thing you remember for your life. Phonation is very important, no doubt. It is one of the most important functions of larynx, but the most important function is protection of the lower airway. So larynx works as both, as a voice box and also as the gatekeeper of the lower airway. Okay, so here we go. So it's obviously a median organ, sits in the midline. We have only one larynx, and it's the infrahyoid region, so it is below the level of the hyoid. Functions obviously phonation, swallowing and breathing. Like I said, there will be a few tweaks. So protection of lower airway, phonation, swallowing, and obviously breathing. It lies in the airway. So it's a triangular, basically a pyramid-like structure. The base is the pharynx in the hyoid bone, and the bottom is the upper part of the trachea. So that you can imagine very well. I don't think this needs any explanation. So this is very important. Many a times this when you are asked in the examinations also. So what is the location of the larynx? What is the position of the larynx? So it ranges from the vertebral levels. It is C4 to C6. Okay, so it's the lower border of C3 to C6. Okay, so and in women it is somewhere higher. Why? Okay, I'll come to that later on. When I explain the anatomy, I'll explain that. Okay, so this is the average size of the larynx. You don't have to remember all these data like 4.4 centimeter, 3.6. You don't have to remember. Just remember one thing, that the anterior posterior diameter is much shorter than the length or the transverse diameter. So it's basically anterior posteriorly a bit flattened. Okay. So what sits below the larynx? Just behind the larynx, what is there? Esophagus. So there is the cricopharynx, the cricopharyngeal sphincter, and the esophagus. So esophagus is a muscular structure. Right. So esophagus is normally collapsed. Right. So if there is a structure which is collapsed, just see, if this is your larynx, these are your vocal cords, the arytenoids. So the esophagus sits like this. So it's like a tube which is anteroposteriorly flattened or collapse. Okay. So what are the structures that makes the larynx? So three median cartilages, very important. So the first firm thing that you palpate in the neck, what is that? So you're going from your chin, going down, the first hard structure that you feel, what is it? This is the hyoid bone. Okay. Below that, we have the Adam's apple, that is the thyroid cartilage. Okay. And then below, if you closely palpate it, just palpate it gently, below the thyroid cartilage, just where it ends, you will feel there is a soft space. And then there is something again hard. That hard thing is the cricoid cartilage. And the soft space between the thyroid and the cricoid cartilage is the cricothyroid membrane. This has some clinical importance, I'll come to that. But remember that cricothyroid membrane is in the midline, sits between the thyroid cartilage and the cricoid cartilage. So what is the importance of this cricoid cartilage? It basically stabilizes the larynx. So it is one of the complete rings. Nothing else is a complete ring. Only the cricoid cartilage is a complete ring. So if there is a complete ring, it stabilizes the entire structure of the larynx. Okay, so there are 4 paired cartilages. Actually, just remember there are 4 paired cartilages and 3 unpaired cartilages. The paired cartilages are what? Now first come to the unpaired cartilages. The thyroid cartilage, the cricoid cartilage, and the first cartilage that we saw in the picture, the epiglottis. Okay, so epiglottis first. So you can see over here the epiglottis, then we have the thyroid cartilage, and then we have the cricoid cartilage here. So these are the unpaired cartilages. And if you are talking of paired cartilages, we have the arytenoid cartilage. If you show the diagram, so I think we'll explain it. We have the corniculate and the cuneiform cartilages. Okay. And we have the intrinsic and the extrinsic muscles of the larynx. So the function of the muscles of the larynx is very important for the exam. Okay. So what are the different types of muscles of larynx? How do they work? Okay, and what are their functions and their nerve supply? This is very important. This is asked for alternate students in Viva. And also, if you have a long question on larynx, anatomy of larynx, you will have to write this down. Okay, so remember to study the muscles of the larynx very well. Okay. So first coming to the thyroid cartilages. So it's a wedge-shaped cartilages, obviously. It's a shield-shaped cartilages, we call it. Like I said, the posterior side is empty. There is nothing posterior. So it's like a shield in front of you. Okay. And this shield forms an angle. Okay. So in the males, you see the Adam's apple. So it means the angle is more acute. It's more sharp. So roughly it's around 90 degrees. But in female, it's more of an obtuse angle. So it's around 120 degrees. So that's the average. It's not exact, but that's the average. So thyroid cartilage, the outer surface. So it has basically 2 surfaces, obviously. The outer surface and the inner surface. And the superior and the inferior horns. So the outer surface, there is an oblique line, which is important. Why? Because there is attachment of the muscles and the membrane in this line. Okay. Well, when we come to the attachments, we will discuss that. Just remember that there is an oblique line. I cannot show you because it's not a bone that I can bring and show you. It's a cartilage which gets destroyed. So I cannot bring a specimen for you to show you, but I can show you pictures. Okay. The superior horns. So here we have just mentioned what are the important structures that gets attached to the different borders and the superior and the inferior horns. Okay. And this area, this depression, So if you feel it, you will be able to understand. Just feel it, there is a depression in the midline. Between the two lamina in the midline, there will be a slight dip. Okay, so that's called the thyroid notch. Okay. So, like I said, the important attachments of the oblique line, the thyroid, sternothyroid and inferior constrictor. See, so say here is your sternum. Okay. We have the trachea in between, then we have the cricoid cartilage. Okay. Above is what? This is the thyroid cartilage. Okay. So, for something to get attached to the thyroid cartilage, it should have the name of thyroid. Either is the origin or is the insertion. Something is getting attached somewhere. So, the name has to be there. Right. So, if you see above this, what is here? The first prominence that you see, the hyoid bone. Okay. So, from the sternum, there is something that comes up to the thyroid cartilage. That's called the sternothyroid muscle. Okay. And then from thyroid, something goes to the hyoid. That is thyrohyoid. So one that is originating from sternum, inserting in on the thyroid cartilage, that is sternothyroid. Originating from thyroid, going to the hyoid is thyrohyoid. Easy to remember. Okay. And laterally on either sides from the thyroid cartilage, there from this oblique line, there originates the constrictor muscles. The inferior constrictor muscle they have mentioned. Okay. And there are some ligaments also attached, because this ligaments helps in maintaining the position of the larynx and also for the movement of the larynx. Okay. So these are the thyroepiglottic ligament, vestibular and vocal ligament. Anyways, we are coming next. So what is the cricoid cartilage? Like I said, it's the only complete ring. There is no other complete ring-like structure in the larynx. That's only the cricoid cartilage. That's why cricoid is very important. So, whenever we do a tracheostomy in a patient, we always try to preserve the cricoid cartilage. We go to the first, second, third tracheal ring, but we never try to touch the cricoid cartilage. Even if it is very short neck, very difficult sometimes to reach the trachea, but we always try to preserve, because if we hamper or we cut the cricoid cartilage to insert our tube, the structure of the larynx will be altered and it will cause a lot of problems. It will end up in a dysfunctional larynx later on. The larynx will not be able to function properly. Okay. Complete signal ring, there is a anterior arch which is which is much narrower, and the wider and the broader posterior arch or posterior lamina. There are these obvious ridges and depressions. What are the functions? Like cricothyroid articulation, attachment of the cricothyroid membrane, ligaments and everything. And also this ridge gives attachment, the central ridge that gives attachment to the longitudinal muscles of the esophagus. So, you see, if you go to the first picture, you will be able to understand. So, just behind this cricoid cartilage, what is there? The esophagus. Right? So, this is the cricoid cartilage, right? This is the thyroid cartilage and this is the cricoid cartilage. Behind the cricoid cartilage is the esophagus. So, there is no separate wall. It is called a party wall, a common wall. That forms the posterior wall of the larynx and the anterior wall of the esophagus. Okay. So, this also, so here the longitudinal muscles of the esophagus gets attached, because it's a common wall. So, if you are doing a surgery like a total laryngectomy or something, when we are trying to take the cricoid out, we have to divide this party wall in such a way so that we can keep some tissues towards the esophagus and some tissues towards the larynx. Okay, so understanding this particle is important. So, like I said, the epiglottis. The epiglottis is very, very important cartilage. Why? Epiglottis has two parts, basically. Because it's a hyaline cartilage, it has two parts. And both the parts, they behave completely different. It's a racket-shaped cartilage, obviously it looks like this. Where does it originate? It originates from the inner surface of the thyroid cartilage. Okay? And it goes up like a leaf. It's a leaf-shaped cartilage or racket-shaped cartilage. And projects above the hyoid bone. So, if you see this picture, like I said, the epiglottis starts from here and goes up like this, above the level of the hyoid. Okay? So, when it's above the level of the hyoid bone, what we do is we divide it into two parts, the suprahyoid and the infrahyoid part. Why do we divide that? There is some reason. Suddenly, why will we divide just based on the basis of the hyoid? We could have divided based on the thyroid, right? On the basis of thyroid, but we don't do. We are dividing it on the basis of the hyoid bone. Why? Because the suprahyoid epiglottis is basically free of any attachments. It's much mobile. While the infrahyoid epiglottis, so if you see this lateral section, see, the epiglottis is coming up from here up to here. So this space anteriorly between the epiglottis and the thyroid cartilage, like if you see this, say this is a thyroid cartilage, this is a cricoid cartilage, and the epiglottis is coming out like this, and you have the hyoid over here. Okay, so this is the suprahyoid epiglottis, this is the infrahyoid epiglottis. So this part of epiglottis is actually attached or adhered. So it doesn't move much. But this part is much more mobile. So functionally both the parts behave differently. That's why we divide into suprahyoid and the infrahyoid epiglottis. So obviously it forms the anterior wall of the laryngeal adductus that I can show you. So it's covered by a mucous membrane. Obviously any structure in the body will be covered by a mucous membrane, and there are multiple attachments of ligaments like the hyoepiglottic, thyroid. So all the ligaments arising from the epiglottis. So when it is going laterally, it's a pharyngoepiglottic ligament. It's going to the hyoid, it's a hyoepiglottic. So multiple ligaments. So these are not ligaments, they're mucosal folds. Okay, which form band-like structures that holds the epiglottis in position and helps in movement of the epiglottis during swallowing or during phonation. Okay. So there are two surfaces, obviously. One is the outer surface. Like if you see, once again go back to this picture. So one surface is towards the tongue. It is called the lingual surface. And this surface is towards the larynx, so it's called the laryngeal surface. Okay, so this one you will not forget. Two surfaces, anterior and posterior surface, we call it the lingual surface and the laryngeal surface. What is the importance? A number of disease, staging, when we do for example a CA oropharynx or a CA larynx, when we are staging it, this involvement of which surface is very important. It changes the stage of the disease because they behave differently. Okay, so that is the epiglottis. So what is the function of epiglottis? It's obviously protection or closure of the laryngeal inlet when we are swallowing. Right, it falls like a leaf. The larynx goes up and the epiglottis falls like a leaf, closing it. Though it is not the most important thing for closure, but then again, so then we have the arytenoid cartilages. So these are very important cartilages. Why? Because the vocal cords get attached to the arytenoid cartilages. Okay, so where does the arytenoid cartilage lie? So if you see this is the cricoid cartilage. Okay, on the posterior side there are two small cartilages which sits on the posterior lamina of the cricoid cartilage on either sides, the right and the left arytenoid cartilages. Okay, so See, arytenoid cartilage, you can see there are multiple projections, multiple processes from the arytenoid cartilages. So, one is the muscular process, one is the vocal process, one is the medial process or the intravitreal. And I'll come to the picture and then I'll show you more. So now again based on the now see it is like stacking. So we have the cricoid, then we have the arytenoid. There is something else that sits on the arytenoid cartilage. It's called the corniculate cartilage or the cartilage of Santorini. Okay, and just anterior to it, hanging in a membrane, is the cartilage of Wrisberg or the cuneiform cartilage. I will just draw a small diagram and I'll show you what exactly it looks like. The picture is not very clear for you guys. So you see this is the epiglottis. Okay. So here are the vocal cords below the level of the epiglottis. Okay. Now from either side of the epiglottis there is a membrane. And see this is the vocal cords. That means the vocal cords are sitting on the arytenoid, like I said. And here we have the cricoid. Right. And thyroid cartilage is only anterior. We have nothing on the posterior aspect. Only cricoid cartilage, like I said, has a posterior lamina. So this is sitting over here. So there is a membrane that comes from the epiglottis and gets attached to the arytenoid. We call the AE fold, Aryepiglottic fold. Okay. So like I said, on the arytenoid cartilage is the corniculate cartilage on either side. And in this membrane, another small cartilage hangs, which is called the cuneiform cartilage or cartilage of Wrisberg. Not much functional importance, but just have to remember the name, the corniculate and the cuneiform cartilages. Okay. So what are the other cartilages? Like I said, the corniculate and the cuneiform cartilage. Just remember these names. You don't have to go much in details for this, for the functions of these cartilages. Now, there are some intrinsic ligaments. So, the ligaments are basically membranes. Just think it as membranes. Okay, then you'll be able to understand better. So, there are two important membranes. One is the quadrangular membrane and another one is the conus elasticus or the triangular membrane. Okay, so from either sides of the epiglottic cartilage to the corniculate and the arytenoid, like I said, there is a fold. There is the AE fold that comes. Okay, so just below the AE fold, there are some, like cartons on either side, like membranes on either side. They form the quadrangular membrane. So you can see in this picture. So there is the epiglottis. That started from the epiglottis and has come down to the arytenoid. You see this picture. Epiglottis started from epiglottis, has come down to the arytenoid cartilage. So AE fold, when we call AE fold, that is this upper edge of this membrane that is actually going down. So the membrane is like this. Antral is the epiglottis, two folds coming in here, and the membrane goes down like this on either sides. You got a picture, or you are not able to understand? If you are not able to understand, please let me know. I'll explain it twice, but this is important. See, for example, say the epiglottis is there in front of me. Okay, from epiglottis is a broad structure. It has a broad base. Okay, so on both the sides of the epiglottis, if you have one curtain this side and one curtain this side, so that forms the quadrangular membrane. Okay, and since it's a curtain, there has to be upper edge. Like the porda jhuliye diyechiস তো উপরে তো একটা লাইন থাকবে, একটা edge থাকবে. So that is the AE fold, Aryepiglottic fold. Now you understand. So for clinical purposes, we use the term AE fold more because that is something that's visible. You cannot see the entire quadrangular membrane. Okay, so that's a quadrangular membrane, and between the now the vocal cord lies almost halfway in the thyroid cartilages, halfway through the thyroid cartilage. Okay, slightly different in males and females, but almost around halfway. Okay, so from these vocal folds, there is another membrane that comes to the cricoid. So that's called the conus elasticus or the triangular membrane. Okay, so what are the extrinsic? This is very boring, I understand, but you have to learn this. This comes in the exam. Okay, so what are the extrinsic ligaments? Like I said, the thyroid membrane. I've already explained to you what is it like. So the median ligament, the lateral thyroid ligaments, the cricotracheal membrane and the cricothyroid membrane. I think I've all explained these things on the diagram that I just drew. Okay, and the ligaments of epiglottis. Like I said, there are multiple ligaments or folds that originates from the epiglottis. The one that is going laterally are called the pharyngoepiglottic ligaments. The one that's going towards the tongue anteriorly is the glossoepiglottic fold. Okay, so one is at the center and two lateral. So median and lateral glossoepiglottic folds. Median one is the center, that has only one, and the lateral glossoepiglottic folds are lateral on both sides. If you don't see a specimen, it's very difficult to understand, to be honest, because like I said, anatomy of larynx is quite complex. Unless you see, I mean, to be honest, when we did our PG, then only we could understand proper the anatomy of larynx. So it's very difficult in the UG to understand and reciprocate it in your mind. But try to create an image. Try to see the pictures and try to create an image. It will be easier for you in the exams as well. So it's the middle, they've written middle, it's actually the median glossoepiglottic fold and the lateral glossoepiglottic folds. Pharyngoepiglottic, thyroepiglottic, hyopiglottic, aryepiglottic. So all the structures around, there are mucosal folds from the epiglottis joining to these structures and it's named by that. Okay. Now what are the joints of the larynx? This is also important. Why? Because see, we have the vocal cords. Okay. So what is the function of the vocal cords? Phonation. Okay, so when we are breathing, the vocal cords needs to remain open, right? You understand that? And when we are phonating, the vocal cord needs to touch each other. So there has to be a movement of the vocal cords. So where is the vocal cord attached to posteriorly? Arytenoid cartilage. So the vocal process of the arytenoid cartilage. So the arytenoid needs to move. Right? Arytenoid যদি না নড়ে তাহলে vocal cord নড়বে না। তাই তো? So it is basically, so arytenoid cartilage is sitting on the cricoid. It is like this on either side. Like this on either side. This allows to tilt forward or behind and changing the tension of the vocal cords. So there are four important things. Either what are things that happen? There can be shortening or lengthening of the vocal cord, or tensioning and relaxation of the vocal cords. So there are different implications. When we go through the physiology of larynx, I think we'll be able to understand or appreciate that. Okay. So like I said, the cricoarytenoid joint. So the arytenoid is sitting on the cricoid. So it allows fronto-translational movement in the vertical axis. Just remember this thing, the vertical axis. Okay. To get away or close the arytenoid cartilages. Like I said, this helps in separation or approximation of the vocal cords. So when the vocal cords are coming close together, it's called adduction. When they're moving away from each other, it's called abduction. Okay? That is clear from your anatomy knowledge, right? What is adduction, what is abduction? You know that, right? So anything coming closer is adduction, going away is abduction. So this is very important for vocal cords. Why? Because for vocal cords, adductions means closure of the airway and phonation. Abduction means breathing. So for a normal life, you need both. You have to breathe and you have to talk. Both the things. So movement of the vocal cords proper movement of the vocal cords is very important, and any hampering or any disease or anything that is causing disrupted or altered movement of the vocal cords can cause significant symptoms. It can be hoarseness of voice, it can be breathing difficulties, stridor, so many things. Okay. So, laryngeal adytus means the inlet of the larynx. So, anteriorly, obviously, we have the epiglottis, like I said. Then the AE folds, like I mentioned, these AE folds. Posteriorly, what do you have? The corniculate cartilage, arytenoid, and the interarytenoidus. That means so these two are arytenoids. So there are muscles that joins these two. These are called the interarytenoid muscles or the interarytenoid. Yes. Okay. So this entire thing, starting from the epiglottis to the AE fold to this corniculate and cuneiform cartilage, arytenoid, this interarytenoid, entire thing forms the inlet of larynx. So if you push something through here, it will go into the larynx. So that is your adytus. That is the laryngeal inlet. Okay, so the vocal cords anteriorly, you see, they are coming close to each other and they are getting attached where? To the posterior surface of the thyroid cartilage. Right, you can see the picture. Okay, and what are the spaces of the larynx? The vestibule, subglottic cavity. I will come to this. So like I said, see, if you see, there are multiple spaces in the larynx. Why? Because there is a lot of mucosal folds, lot of ligaments and mucosal folds. So there has to be a lot of spaces. If you have something, if you say multiple cartons in this room, so you have a lot of small pockets and spaces in the larynx. So similarly, because of these folds and these things, there are a lot of spaces in the larynx. So what is the vestibule? So the vestibular folds are basically, how do I explain this? So above the level of the vocal cord, there are spaces. When there are mucosal folds. So see, if you come like here, so the vocal fold comes out medially and forms the vocal cords and it goes down. So there is a space here. Okay. So that's called the vestibule of larynx. And there is the ventricle of the larynx, that is the vestibular and the vocal folds. So if you actually draw this picture, it is like a swelling here and then there is formation of the proper vocal cords. This fold, the upper fold is called the vestibular fold and this fold is called the vocal fold or the vocal cord. Okay. Okay. So this area, this space is called the ventricle. So it goes like this. It's basically a little dip. বুঝতে পারছিস না সো it is difficult, I understand, but যদি না বুঝতে পারিস প্লিজ ক্লিয়ারলি বল, স্যার এই জায়গাটা বুঝতে পারছি না, একটু ক্লিয়ারলি বোঝান, কারণ এটা বুঝতে হবে, না বুঝলে কোনোদিন মনে রাখতে পারবি না. It is impossible to learn this by heart and remember. ঠিক আছে, আমার মনে হয় we should not go into too much details about the ventricles and folds because it is difficult to understand until you see the specimen or see a surgery of the larynx. So what is a glottis? It is important. So glottis is what? It is a true laryngeal inlet. মানে কেন বলছি, see if there is a foreign body or something, okay, that has bypassed the epiglottis, that has crossed the epiglottis. So it has officially entered into the larynx, right? But until unless that thing crosses the vocal cords, okay, it is not into the lower airway. Okay, so the vocal cords are the last level of protection. Some people may have the view that vocal cord is the only level of protection. No. Vocal cord is actually the last level of protection. Before that we have the false cords, we have the vestibule, we have the epiglottis, so many things. So vocal cords are the last stop. If something crosses the vocal cords, it will straight go to the trachea in the lower airway. Okay, so Vocal folds are actually the narrowest portion of the larynx, except for kids where subglottis is the narrowest portion. Okay, and so anterior 3/5 is the membranous part and the posterior part is the cartilage. Why? Like I told you, say here is the arytenoid, here is the arytenoid and it has this vocal process. So the vocal process goes to some extent into the vocal cords. So the posterior most part is the cartilage, which is actually the vocal process of the arytenoid cartilage. And the anterior part is the membranous part, which is found by the vocal ligament that I just described. ওকে, ধর এরকম দুটো হাত তোদের দেখিয়েছিলাম, যে এই দুটো হাত তো ভোকাল প্রসেস, তো এইগুলো দিস ফর্মস দ্য পস্টিরিয়র পার্ট অফ দ্য ভোকাল কর্ডস। এর সামনে থেকে যে মেমব্রেনটা গেছে দ্যাট ফর্মস দ্য মেমব্রেনাস পার্ট। বুঝতে পেরেছিস? So posterior 2/5 of the intercartilaginous part and anterior 3/5 is the membranous part. So the structure of the vocal cord, how, what are the layers of the vocal cord? So obviously there will be the mucosa, the epithelium, the outermost part. Anything in body is covered, any space is covered by epithelium or the mucosa. Then we have the basal lamina and the superficial layer of the lamina propria. This part is called the outer covering of the larynx, vocal cords, or the cover. Okay. The next part is the middle part of the vocal cord, or we call it the transition zone, where we have the intermediate layer of the lamina propria and the deep layer of the lamina propria. Okay, so what is lamina propria? Is basically some loose connective tissue below the level of the mucosa. So there are basically three layers: the mucosa, the lamina propria, and then the muscle. The muscle has to be there because the vocal cord is moving. বুঝতে পেরেছিস? টেনশনিং হচ্ছে, বললাম না এক্ষুনি, শর্টেনিং হয়, লেন্থেনিং হয়, অ্যাবডাকশন অ্যাডাকশন হচ্ছে, there has to be a muscle inside that. মিউকোসা তো আর শুধু শর্টেনিং লেন্থেনিং হতে পারবে না, there has to be some movements, has to be a muscle inside. So the body of the vocal cords is formed by a muscle called the vocalis muscle. Over and above this vocalis muscle we have these structures, the three layers of the lamina propria and then the mucosa. So basically 5 layers: the mucosa, superficial, intermediate and deep layer of lamina propria, which is the loose connective tissue. Below that we have the vocalis muscle, that is the deepest layer. Okay, why is this important? Because like the depth of the disease determines how much to operate, when to operate, what to operate when we are considering surgeries. For example, you have a vocal polyp. It's very common, vocal polyps. Okay, from voice abuse, teachers have vocal nodules. So these things usually involve the epithelium, or at most the superficial layer of the lamina propria. But when we are digging deep down, it's like it's a malignancy, it's going inwards, so it's invading the muscles. So what will happen if there is some invasion in the muscle or the space beyond that? Muscles will be paralyzed. For example, a cancer involving the muscle or going into the paraglottic space, that is deep to the muscle. What will happen? The muscle will get paralyzed, so there will be no movement of the vocal cords. Okay, so understanding that is very important while examining a patient. So these are the layers that you need to remember. Just remember the names. Okay, no one is going to ask in details. Just remember the names of the layers of the vocal cord. So these are too much in details, I don't think you'll need all this. So this superficial layer of lamina propria has a space between the mucosa and the superficial layer, which is called the Rinke space. So when there is too much trauma, that can be voice trauma or that can be anything else, that can be any outside agent or anything that's causing some stress to the vocal cords, there may be collection of fluids in this space, Rinke space, and it's called Rinke's edema. That is what we call the vocal cord edema. Okay, it is usually a benign condition, it subsides with medication, voice rest. When you give less stress to the vocal cord, there is, or you take steam, keep the vocal cords hydrated, it gradually goes down. Okay. So the intermediate layer, like I said, the elastic fibers and the collagenous fibers, they form the layers of the lamina propria, and the body, like I said, the main structure is the vocalis muscle. Okay, so it's just a picture. So what are the muscles of the larynx? So muscles of the larynx is important because this helps in movement of the larynx. So when we are swallowing, the larynx is going up. Try holding your larynx and swallow. You'll see the larynx goes up and again comes down. Right? It always happens. So this movement, why is this movement important? Because the larynx goes up and the epiglottis falls. It closes the laryngeal inlet and the esophagus opens up. The cricopharynx opens up. The cricopharyngeal sphincter so that you can swallow. Okay. So these muscle groups are important. The suprahyoid, the infrahyoid muscles and the extrinsic muscles. So the extrinsic muscles, mostly the commonest muscles that you need to remember are the names of these muscles, the omohyoid, sternohyoid, thyroid, all these muscles that I just already showed to you where these muscles are. The suprahyoid muscles, so anything above the hyoid is suprahyoid, anything below the hyoid is infrahyoid. So hyoid and above, like hyoid to the styloid process, the digastric muscles. Okay, these muscles are getting attached to the hyoid. So what is that doing? If these muscles contract, what will happen? So you are attached to something above and that's pulling you. It will go up. Okay, so these are elevators of larynx. So suprahyoid muscles which are getting attached to the hyoid are basically elevators of the larynx. So they are elevating or picking up the larynx when we are trying to swallow. Okay. And the infrahyoid muscles, like I said, are the depressors of larynx. Obviously, something below the larynx, so it's depressing the larynx, pulling from. So any muscle that is contracting is shortening. So whenever a muscle is contracting, it is shortening and pulling the structure down. So infrahyoid muscles below the hyoid, pulling the muscle larynx down, depressors. Suprahyoid muscles above the hyoid, pulling the larynx up, elevators. Okay, very easy to remember this thing. And the constrictor muscles of the pharynx that helps in swallowing and peristalsis. So the intrinsic muscles are mostly related to phonation. Okay, so extrinsic muscles are mostly related to protection of the airway, and the intrinsic muscles are mostly related to phonation. So they actually help in maintaining the shape and size of the glottis, the true glottis, that is the true laryngeal inlet and the vocal cords, obviously. So what are the main important muscles? The cricothyroid muscles. So if you see those pictures, it's I think it is not easy, but then again, cricothyroid means thyroid to cricoid, right? But this is an intrinsic muscle. Okay. Then we have the posterior and the lateral cricoarytenoid muscles.
This is class from 9 to 9:50. Your class is going on?
Yeah, 9 to 10, I think. Yes, sir.
I just clarified.
Okay, thank you, sir. So the posterior and the lateral cricoarytenoid, the oblique arytenoid, and the lateral medial thyroid. I think we will take more time for this because each muscle has a separate function, and it is very, very important to understand these functions. Unless I draw pictures and show you how these muscles work, you will not be able to remember. Just remember a few important points. Like the cricothyroid muscle, like I said, it originates from the thyroid, cricoid, and goes to the thyroid. So it causes lengthening of the vocal cords. So it's like the vocal cords are like this. Okay, the cricothyroid is posterior. So when they contract, the space between the thyroid and cricoid will increase. That will cause more tension on the vocal cords. So that acts as a tensor to the vocal cords. Okay, it's supplied by the superior laryngeal nerve. The posterior cricoid muscle is called the safety muscle of larynx because it is the only abductor muscle of larynx. Please do remember this name. Posterior cricoarytenoid. This is the only abductor of larynx. Rest all muscles, however they work, they cause adduction. That is closing of the vocal cords. Only this muscle is something that called abduction or the opening up of larynx. So if you're not able to open up your larynx, you're not able to breathe. Right? So it is called the safety muscle. Okay? So the lateral cricoarytenoid muscle. So all these muscles has some function in either shortening, lengthening, or no tension and relaxation of the vocal cords. So all the muscles are just described in this. Vocalis is the same. It's like I said, it helps in adduction of the vocal cords. It contracts, so there is adduction of the vocal cords. Phonation, like I said, phonation is important when there is adduction of the vocal cords. When the vocal cords are coming close together, then you phonate. Then you are able to talk. So there are some mucosal waves that passes through the vocal cords. So what you do is you initially breathe, hold the air in your lungs, and gradually blow the air out through the larynx when there is vibration of the vocal cords causing the sound. Okay, so speech is different, phonation is different. Phonation is creating that sound and speech is articulating it to make understandable words. ঠিক আছে, এই দুটো যেন মাথা থাকে. So variation in length and tensions of the vocal cords, these are the two important muscles, the cricothyroid and thyroid muscles. Posterior cricoarytenoid is also an abduction. So these are written in the books. I think we'll need a separate class to understand the muscles of the larynx. This is important. So like I mentioned the spaces, the subglottic, preepiglottic, paraglottic spaces. I think this is a lot more actually. I mean, lymphatics is our venous drainage is not required, but blood supply of larynx and nerve supply of larynx is very important. Okay, you don't need to know much about all these spaces, but just remember the pre-epiglottic space. Okay, it is like I said between the epiglottis and the thyroid cartilage. That space, this infrahyoid epiglottis and the thyroid cartilage over here, there is a space in between. This space is called the pre-epiglottic space. So there is a lot of fatty tissue in here and there is less blood supply. It's not much vascular. Okay. So paraglottic space is something that is lateral to the vocalis muscle. Okay. Involvement of this space, like I said, causes paralysis of the vocal cords. Okay. Subglottic space is obviously anything below the glottis. Blood supply mainly by the superior and the inferior laryngeal artery. The superior laryngeal artery is a branch of superior thyroid artery. So superior thyroid artery comes, there is a superior laryngeal artery which goes to the larynx and the rest of the superior thyroid main trunk comes down towards the superior pole of the thyroid. Okay, and the inferior laryngeal artery is a branch of the inferior thyroid artery. Okay, so thyroid and larynx, since the thyroid gland is sitting on the trachea, so it's the same blood supply that comes from the external carotid artery for the superior and the inferior from the subclavian. So the cricothyroid artery is not something that's very common. Superior inferior laryngeal veins, don't need to know much. Lymphatics is important. So anything above the vocal cords, they usually drain in the level of in the level 2 or 3. Anything below at the level or below the level of vocal cords can go to the level 3, 4, 5. Okay, or the central compartment at the level 6 nodes. Nerve supply is very, very important. Very, very important. Is one on the, the most important question asked in your exam. The superior larynx, the external branch of the superior laryngeal nerve, okay, it passes close to the upper border of the thyroid gland, and then it cuffs up and enters the larynx. Okay, so this is the nerve supply of the cricothyroid muscle, which is an adductor of the vocal cord. Okay, and the internal branch, that is a sensory branch. So superior laryngeal has two branches, the external and the internal. The external supplies the cricothyroid muscle, that's a motor branch. The internal is a sensory branch, which is supplying the mucosa above the level of the vocal cords. Okay, and all other things are supplied by the inferior laryngeal nerve, that is the recurrent laryngeal nerve. So the inferior laryngeal nerve is actually something that goes below the subclavian, loops around it and comes up. Since it creates a loop, it is called a recurrent laryngeal nerve. Okay, so that is nothing, recurrent laryngeal nerve is nothing but the inferior laryngeal nerve. So you have the superior laryngeal nerve and the inferior laryngeal nerve. Inferior laryngeal nerve is also called the recurrent laryngeal nerve. Okay, so all muscles of the larynx are supplied by the recurrent laryngeal nerve except এক্ষুনি তো বললাম cricothyroid is supplied by the external laryngeal nerve. ठीक है? So the branches of the recurrent laryngeal don't have to remember all these branches.